The opposition leader was alone today while expressing his disappointment of the state of emergency. He described the whole SOE as a scam to benefit a handful of individuals. He says the SOE is a public health issue and not a law and order operation. Namah wants the curfew to cease.
This is not a law and order issue. This is a public health issue. As such, police must exercise restraint and refrain from intimidation and having violence on our citizens. This exercise of SOE, because it's a public health issue, the high-powered weapons carried by police and the military personnel should be concealed at all costs.
With the controller, Prime Minister, Police Minister and Health Minister making announcements of testing, report of PPEs among others, Namah says there is inconsistency in information released to the public. The opposition leader says this proves that PNG has no capacity to test all persons of interest. With the government ramping up on contact tracing, Namah says funding should be focused to support medical institutions.
All I'm seeing is bounds of clowns making announcements saying it's positive, the next minute they come back and they say it's negative, and then one post and says that I am negative. What a shame. What a shame. We need scientific proof and evidence, and that can only be provided by our qualified scientists and our qualified doctors.
The opposition leader took no chances and bluntly blamed the government for making poor decisions for the state of emergency. Namah says the government is not responding to COVID-19 but reacting. He wants an audit into the SOE operations.
Coronavirus is a separate issue and must have its own funding. And if these funds have been plucked out from somewhere else, from the 2020 budget, or there has been donations from other countries, or if there was a loan of 20 million from the World Bank or IMF, then we need to account. Because at the end of the day, this country and its people are going to be responsible to repay those loans.
Jack Lapava Jr., National MTV News.